You are not alone and you are not the only one. If you are watching this video, you have likely been diagnosed with HIV or know someone who is HIV infected. Many things have changed since HIV was discovered. HIV is widespread and affects people across the globe. It is estimated that more than 30 million people are living with HIV/AIDS. Anyone can become infected with HIV. Men and women, straight and gay, those who inject drugs and those who don't. We are all affected by HIV. One of the first things that you may wonder if you were recently diagnosed with HIV is, am I well or am I ill? Many people have no symptoms when they discover they are HIV positive. How can you tell what stage of infection you are in? As you can see from the slide, HIV infection is divided into 3 phases. The first is acute infection and refers to the first few weeks after infection with the virus. The second is called the asymptomatic phase, which lasts on average 5 to 10 years. And the third is advanced disease, often referred to as AIDS in order to describe the immune deficiency that characterizes this phase. There are a couple of key concepts you should know about. The first is the CD4 count. This is a measure of the strength of your immune system. HIV infection is characterized by a slow and progressive decline over many years in the CD4 T cell count. The risk of illness increases significantly when the CD4 count drops below 200 cells per ml. The second concept is the viral load. This is a direct measure of the virus in the blood. The higher it is, the more virus is present. The viral load test becomes especially important when you start taking therapy. What happens to this graph when treatment is initiated? As you can see, when antiretroviral therapy, that is HIV treatment, is started, the viral load decreases because antiretroviral therapy suppresses the virus by blocking its capacity to replicate. This process is indispensable because it allows the immune system to recover. This keeps you healthy and prevents you from becoming ill. Many people with HIV express doubts about the future. Will I find love? Can I take a vacation? Can I have a child? Well, the answer is yes. You can plan ahead to whatever your hopes and dreams are. With good adherence to antiretroviral therapy, a person infected with HIV has a life expectancy of more than 30 years, and most people will live a healthy life to old age. What if you have problems taking your treatment? Many things have changed since HIV therapy was developed. At the beginning, there wasn't much choice. Few medications came in combination, they had to be taken many times a day, and often caused serious side effects. But research in the field has made great strides. There are now 25 different medications to treat HIV. Most of them come in combination pills. Side effects are fewer, and when they do occur, your doctor can address them by making changes to your regimen. How does treatment help you? With good adherence to antiretroviral therapy, the medications will block viral replication, help your immune system recover, and prevent complications and illnesses. Remember, your treatment is working well if your viral load is undetectable, that is less than 50 copies per ml, and your CD4 count is rising. How does HIV treatment work, and how do we choose a regimen that's right for you? Nowadays, antiretroviral therapy consists of a combination of drugs that act together to suppress the virus. It is well tolerated and can be personalized to your own particular needs. Are you taking your regimen correctly? The simple answer: if you are taking your pills every day at the same time, then yes. But if you skip doses, frequently change the time you take your pills, or decide to stop treatment on your own, the answer is no. Regular dosing allows you to achieve effective drug levels in the blood. This prevents the virus from replicating. But if you take your medications irregularly, by skipping doses, taking your pills late, or interrupting treatment, you can cause yourself serious harm. The virus can escape the control of the medications, replicate and mutate, creating drug-resistant strains. What is a resistant virus? A resistant virus is a mutated virus that manages to escape from the control of your medications. Poor adherence is the leading cause of drug resistance because it reduces the pressure the drugs put on the virus. This allows the virus to escape the control of the medications, mutate, and become resistant. Here are 10 tips for never missing a dose. Take the fewest number of doses per day. Most antiretroviral regimens can be dosed once a day. Identify your most stable daily routine and take your pills at the same time. A good example is when you brush your teeth at night or in the morning with breakfast. Choose a routine that happens at home. That way you don't have to bring your medications with you. Always remember to take your medications within an hour before or after your chosen dosing time. Use an alarm to help you remember. Involve your family and friends. They can be a great support. Get a pill box and organize your pills. Always have an emergency dose with you. Never let your medications run out. Get your refills on time. If you happen to skip a dose or decide to stop treatment, speak to your doctor about it. Your doctor is there to help. If you have any symptoms or side effects from the medicines, ask your doctor for advice and support. Good adherence. We're all in it together.